Hi, Dr. Thayer here. Happy Valentine's Day to you people. Even though this is probably going to be 3 or 4 months later, you'll be like, that's February, and this is May or June when I'm seeing this video. Well, I shoot them sometimes, and I keep them in the can, and I don't produce them until later. So, anyways, happy Valentine's Day. Okay, so, I got Donovan here. Sorry, my shtick. I got Donovan here. He works at a theme park. And he has neck pain and low back pain. He's been working there for about 4 years, 3 or 4 years, and he's here because he's just not getting better. It's hurting. He's worried about longevity, and you're what, like 55, 60 right now?
Yeah, about that.
Yeah, about that. And so he's worried about working there for his lifelong kind of thing, and so he's just like wants to get in and get care because it's hurting to work there. So anyways, he's here. We're going to take care of him. Donovan, tell us why you're here.
I'm here just based on what I do requires a lot of physical exertion. I'm on my feet. I do a lot of performance, and I've noticed that it's, I go home at the end of the day feeling a lot more tired than I used to.
Yes,
than
exactly.
I should, and
takes you longer to recover, that kind of stuff.
Exactly.
Yes, exactly.
And
then even the job is hurting. It's like by the middle of the day, you're like not even wanting to go to work because it hurts, right?
Yeah.
Kind of deal. So your life is changing, or it's because of the pain.
Yeah.
Right. Okay. So he's here like anybody else. I mean, pain motivates people to come in, but really, it's interrupting your life, right? And again, you're not an old person. You want to have this. You love what you do. It's just a matter of just hurting him now. So I'm glad you're here. So tell us what your pain is.
Definitely neck pain. Moving my head side to side. There's a lot of pressure on the left side, on the right side. I feel like that's affecting my hearing, my balance, my grip strength, like you were saying, and then a lot
He's getting ahead of the game right now. We already have all stuff worked out, but he's trying to throw this stuff out there.
And then my lower back.
Gotcha.
Like in the
pain gets worse as the day goes on, the more you work at the park, right? Okay, gotcha. Okay, so let's go over a couple things. You have headaches too.
Yes.
You have ringing in your ears, chronic ringing in your ears now. The right is worse than the left. Shoulder pain, daily pain. He has pain down his arm. This is why you're really here. This right shoulder is really killing him. Numbness and tingling in his hand, right? We have low back pain. Anything else? Oh, you don't sleep. You sleep. You wake up. You want to sleep longer, but you're not able to sleep very long.
Yeah.
Too. Gotcha. That's pretty much it, right? Okay, so let's go through all the things. Anything else you want to add?
That's pretty much it.
Perfect. Donovan, over here, please. Okay. So knees straight, just like we talked about before. Go ahead and bend over as far as you can. Okay. Any pain in your back, sir?
Yes, like
right there on the right. And a scale of 1 to 10, what is that?
Right now, about like a 4 or 5.
4 or 5. Good. Go and go back like this. On the right side or the middle?
In the middle.
Middle. And what is that scale of 1 to 10?
I think 6, 7.
6, 7. Okay. Look at the floor, please. Any pain in your neck there?
No.
Look at the ceiling. Pain there at all?
No.
Not really. Okay, so good. Nothing. So again, you guys, I say this every single time. 0 neck pain, lots of low back pain, yet I'm going to treat his neck. Actually, we got one more thing to do. I forgot. I made a big deal about nothing. The other one, left and right. That one hurts.
Yes.
6 or 7?
7, definitely.
So erase what I just said a minute ago.
Yeah.
Okay, now other way.
Yeah.
And it's over here, right? Got 6 or 7. Okay, so nothing forward and backwards. Yeah. Okay, so he has some other issues that are kind of interesting to me. He has a hearing deficit, which has gone on for how long?
It's been noticeable for the past year.
Past year.
Yeah.
So please explain really quick what that means to you, that you've seen the change.
I feel a lot of pressure build up in my ears, and when I'm conversating, whether at work or just with friends, I find that I have to ask them to repeat, even when we're like all sitting around a table.
No reason, no background noise, just you have to repeat, right?
Yeah.
Gotcha. So we already did this check. We're going to do a little tuning fork check, and we're going to do a snap check, and that's just kind of just a general hearing thing. Usually there's deficit side to side. He doesn't seem to have that. It's an overall deficit, so we're just going to see. I'm just kind of curious if you'll have a difference in hearing after we adjust him. So let's just do this real quick. So look at the camera, please. Okay. Can you hear that right? Good. We'll do this too now.
You could hear it a little bit better.
A little bit more on the right, tiny bit more, but it's pretty close, right? I just want you to kind of pay attention to the overall sound. Okay. Now we're going to do one more thing: grip strength, and this is an easy one to see. Okay. So grip, you're right-handed, right?
Yes.
Okay. So squeeze as hard as you can. Okay. And look at this. So squeeze as hard as you can. He can't even squeeze my hand. Squeeze as hard as you can. So he doesn't even nothing.
Yeah.
Say nothing. Okay. On this side. So squeeze, and so now squeeze hard. And so now you can feel the strength, right? And you're right-handed.
Yeah.
So he's lost grip strength over there. So that's also part of this, guys. It's not just about pain, not just about numbness, not just about what he's feeling here. It's also about loss of strength. And he's a young man. He wants his strength back. So, ready to get adjusted?
Yeah.
Good.
Let's do it.
Glasses off, please. All right. Over here. I made that mistake in there. Does that sound like rewind? Yeah. Okay. Scoot down a little bit. Okay. That's my editing. Okay. So, camera, please. X-rays. Definitely some stuff for him to worry about on his X-rays. He looks like a low back patient on his X-rays. It looks like a hot low back actually to me, which he doesn't seem to compare. He doesn't seem to have a problem with nearly as much as his neck. So interesting there. Balance is way off. Atlas is way horizontal. Neck is way reversed. Lots more issues than he even thinks, and we're going to show you that next time. Okay?
Okay.
Good. Yeah. I was surprised actually when I saw him. Okay. So fingers on your belly, please.
Yeah.
Oh, Donovan, tell people what you've done in the past. You've done chiropractic once when you were a kid, right?
Yeah, chiropractic care when I was a kid, and then just to cope with what I've been dealing with a lot, just massages, a lot of stretching.
That's right, once a month massages, some stretching.
Yeah,
he has, at the Slean Park, he has access to athletic trainers.
Yes.
Good.
Yeah.
And that has not helped. Yeah. You mean strengthening the muscle doesn't help the back? I'm sorry. That was sarcasm. My bad. Okay. So, again, it's been a long time since you've been adjusted.
Yes. The
more you can be relaxed, the better. We're going to start off real slow. Just let your head be heavy on the table, okay? I'm not going to rush things. You see how I take my time in the videos. Good. You're doing fine. Okay, right there. Good. Okay. Like what you expected? Good.
Even better.
Even better.
10 out of 10 would recommend.
10 out of 10. Okay. So, nice and easy on this side too. Okay, right there. Okay, just take your time here. Good. Good, nice. Now, without me even prompting you, I can feel the difference already. What do you feel after that? I mean, not just the adjustment noise, but you feel different right, in my hands right now.
Yeah, I feel way lighter.
And you're even laying down, you're lighter.
Yeah, it felt like it was even more stronger on the left side.
Yeah, I mean, it's serious, guys. His body is completely different now. It's like he feels like about 20 pounds lighter.
Yeah.
There's no way it can be that way, but you feel lighter too to me. So anything else?
I feel like there's like blood rushing back to my body.
Cool.
Yeah, I don't feel as heavy.
Good.
Yeah, it feels great.
So when you get up, Donovan, no twisting or turning like we talk about. Look straight ahead, keep your arms to your side, okay?
Okay.
Good. Excited? Ready? Good. Let's go. Sit on the table. Okay. There's glasses. Come around with the camera, please. Dizzy, lightheaded at all?
Yes.
Gotcha. And we talk about this all the time with the camera people, that this dizziness and lightheadedness is what we're looking for, not what we're trying to avoid. We're looking for this because that means I'm affecting his balance centers. And when I'm affecting his balance centers, that means I'm helping him change his body for the positive. Okay? When you walk, that's going to recalibrate your spine, meaning, you guys don't believe me on this one either, that the spine up here will spread out through the whole top body, connecting together, and you'll feel a difference overall after you walk, okay? Go ahead and walk, please. You step right here, go back to the door. Next up right here. Feel, what do you feel right now?
Still a little lightheaded, a little dizzy.
Walk some more, please. Slow, deep breath in your nose, out your mouth. Good. You look like you're still a little dizzy, actually.
Yeah.
Gotcha. See, when you really affect somebody a lot, you can see it in his eyes. His eyes are actually dilated right now because his brain is trying to figure things out. One more lap. Good. You almost look like you're on a amusement park ride. Do you like that feeling? You know, I mean, you kind of look like you went on those spinning things. You're like, dude, you look like that right now.
Yeah, it feels like it.
Yeah, it's funny. Okay, so how do you feel off the top of your head besides the dizziness?
I feel
so lighter kind of deal.
Lighter, yeah,
Anything
definitely.
else? Without moving, just kind of curious. Anything else?
I don't know, it feels like I can feel my neck more, if that makes any sense.
Fair enough. Fair enough.
Yeah, it just.
I love the first impression out of people, so I'm always curious. So let's take a look at some of those range of motions. Touch your toes, please.
Okay.
You got a 3 or 4 out of 10 before a minute ago.
Yeah, I didn't feel anything.
So you're saying it went from a 3 to 4 to 0 now?
Yeah.
Okay, just curious. Want to go back? That was a 6 or 7, I think, or no, was it 5 or 6? I forget what it was.
It was like a 6, 7.
6, 7.
Not about
honest.
3, 4.
3, 4,
yeah.
so about half less. Okay. We don't need to look up and down because there was no pain there, so go ahead and left and right.
Okay.
Those are 6 and 7s.
Yeah. Probably 3 or 4 right now. 1 and 2.
1 or 2.
Yeah.
So 50 to 80% better. Kind of cool. One more lap.
Yeah.
Okay. So this is the fun one. This we're going to do the neurological test real quick. I just want to give it every chance. You may or may not remember it with the sound and the voice, but or the snapping. We'll see. Okay. So just tell me if there's a difference. If there's not, no big deal.
Okay. I can hear a little better on this side. It's interesting. Yeah.
Are you just saying that?
No, I can actually. It's more resonant.
Because you are a people pleaser being a theme park worker.
I'm going to give you all the answers you need.
Yeah. Whatever you say, Dr. Thayer. Okay, let's do this one now, okay?
Same.
Same?
Yeah.
Same as before?
Yeah.
Gotcha. So a little bit different in vibration. Now let's check one more thing. Tell me. You tell me.
It's all about the same to me.
Okay, fair enough.
Yeah.
I felt it a little bit different, but
okay.
His words. So good. Anything else you want to say? Anything else you have questions about? Feel different, right?
Yeah.
Good. A lot of fun, guys. I'll see you next time. We'll get a catch up with him because it'll be fun to see what we do with the next time.
Yeah. Like and subscribe.
Like and subscribe. Yes. Good. Thanks, guys. That's funny.